welcome back to Fossil vs. Future. I'm Daisy.
And I'm James.
And today we're going to talk about...
our health.
What about our health? When we talk about climate change, the conversation often drifts towards economics, the financial costs, the investments, the business case, or it's framed in terms of our planet, melting ice caps, rising sea levels, loss of biodiversity. But there's another way of looking at climate change that brings it much closer to home, one that affects every one of us, human health. The climate crisis is a health crisis. Rising temperatures and more frequent heat waves are already deadly. Globally, 37% of all heat-related deaths can be linked to human-induced climate change. And among people over 65, heat-related deaths have risen by 70% in just 2 decades. Flooding doesn't just damage homes, it disrupts healthcare access and spreads infectious diseases. Shifting rainfall patterns and warmer temperatures are enabling the increased spread of insect-borne diseases like malaria and dengue. In Africa, yellow fever deaths are expected to rise by 25% by 2050 due to climate change. Climate change lengthens pollen seasons, worsening seasonal allergies. Air pollution, often associated with the burning of fossil fuels, already accounts for more than 8 million premature deaths every year. And climate change is also deteriorating access to the basic human needs, secure food and safe water. And it's not just about physical health, it's about mental health too. 59% of young people aged 16 to 25 are very or extremely worried about climate change. Climate anxiety is becoming a defining feature of our generation, a weight that our parents and grandparents didn't have to carry. And while no one is immune, it's the most vulnerable communities who will be disproportionately affected by these health impacts. Framing climate change through health makes it personal. It's not about invisible greenhouse gases or distant ice caps. It's about you, your family, your community. Maybe it's time to stop talking about climate change only in degrees of warming and start talking about it in lives lost and lives that could be saved.
I am beginning to think that this is an angle for communication, maybe particularly because of the points you were making about the sort of generational angle.
Yeah.
But also perhaps because of the potential to connect generations around the issue of health. We often talk about vulnerabilities to the elderly from heat, as you said.
Yep.
But equally, the instinct to care for the generation behind you, your children and grandchildren, is strong. And one senses that health might be, to borrow a phrase, a vector, a channel, a route to a deeper understanding of the need to act, but also an appreciation of consequences. It's quite remarkable how these consequences have sort of arrived little by little. And I'm not saying they haven't been noticed, because I think when you mention it to people, they do have some experience of mosquitoes being more of a feature of life in Europe than perhaps they had been in the past. Someone will have had that experience. And so it can be fitted in with scientific and the sort of data and analytics that go with public health research. And increasingly, those institutions that do that work have collaborated with the institutions that do that work on climate. So public health and climate are starting to overlap as research agendas. And so we're learning more about how a warming world has distributed disease in a different way.
Although not in the US, isn't that being cut, the funding for research between climate and health?
This is happening, yeah. Extraordinary.
Mm-hmm.
And some very well-known and very highly regarded institutions are really in Harvard. The Harvard School of Public Health is currently under huge pressure through the defunding that is going on for multiple political purposes. But it will have real-world consequences. And indeed, the withdrawal of funding from the various aid agencies, USAID and others, not just in the States, but that is going to make some of these manifestations of climate change in parts of the world that are most vulnerable the more extreme. Yeah.
I think everyone will feel some effect. So in the UK, for example, we had that was it 2022? We had that really hot heat wave above 40, I think.
Yeah, the first time we had
Yeah.
those sorts of numbers, yeah.
And we are beginning to see more mosquitoes in the UK, for example. But yeah, I think that is a thing of real importance with this topic, is it is going to affect the people that are most vulnerable the
Yeah.
most,
Yeah.
whether that be older generations, women, children.
There is a pretty clear inequity at play, both between countries and within countries.
Mhm.
You see it very clearly. We'll get into some of the things you can do about this.
Yeah.
So we don't spend the entire conversation thinking that the end of the world is nigh, but the consequences affect those most vulnerable in every sense of that word more than those who have greater resilience because of their wealth or their capacity to protect themselves from, particularly from disease. Some of the other manifestations are, pretty much affect everybody. But I think the strain on public healthcare systems, the way in which societies have to adapt to sets of problems they're not familiar with, and also this mental health issue, which is very real. And one of the reasons why we're making our small contribution by having this conversation is that we'd like very much to engage a generation that feels anxious and full of despair.
Powerless, yeah.
And powerless, to feel as if, well, if they really get to grips with the problem and have speak to those who do have the power to make a difference, there will be a future that is better than they fear, that there are solutions out there. Those solutions are tangible, meaningful, realistic, and life can get better having solved the problem.
Yeah, I think that's something that I find quite helpful, is by doing this podcast or working in sustainability, I feel like I'm doing something, even such a tiny thing, towards helping to contributing to solving this problem, that helps me feel a bit less anxious about it, I think.
And it would anybody
who
was, well, yes, of course. And it would with anybody who's got can find some agency on their own, but mostly with others, let's face it. A lot of what we've said in previous episodes has tried to encourage people to self-organize or to find organizations that they can work with at whatever level to do something that feels like an advance or a way of, I know it's a cliche, but it's a pretty good and simple way of explaining that there are opportunities to solve a problem, find a solution, and win twice over. And if you look at, let's go back to the kind of how would one respond to these multiple risks that are coming, bearing in mind that the public healthcare systems of the world are pretty much stressed anyway.
Yeah.
And where cost is a really important feature, and increased morbidity is also a cost. And there is also, a challenge to find ways of coping with climate change in environments that are actually quite difficult to change, but not impossible. So an urban environment affected by extreme heat, what actually can you do about that? Well, we've got a few methods to do something about that, including quite simple ones like greening them,
planting
trees, rooftops, making sure that there are more green spaces. It's not exactly a modern technology, but trees really make a difference to the cooling. And we've discussed this before, that in most cities, in most parts of the world, there is a very obvious divide between where the green spaces are and where they're not. If they're open public spaces, actually we have quite a few in London, then anybody can have access to them. But the greenest suburbs tend to be the wealthiest ones, and where there are no trees, more extreme heat has more of a consequence. And that's something that pretty much any city, anywhere, properly and well governed, can do something about. The same with transport, isn't it? The same, if you can produce an urban environment where there's more opportunity to walk or cycle, or where the infrastructure for electric vehicles are built in, then your air pollution will come down, and you'll have a less stressful environment for people to go to and from work. Same with good public transport systems. All of those produce opportunities, at least, for solutions that make life better.
And with physical health benefits and mental health benefits, because you're walking and cycling more, so you're
Yeah.
exercising, or you're having fresher air as a result of the trees, and so then that's healthier. But then also green spaces are really good for well-being and that connection with nature.
They really are. There's lots of evidence of that.
Yeah.
Whether in a city or in in a rural environment. That's largely to do with access, isn't it? In the rural environment, how can I actually get to that lovely place that will make me feel better if I'm walking in it? And I think there's also a sense that overlap with public health and sport we've talked about before, the ability to enjoy green spaces, that we know has multiple benefits. So that's a way of addressing a climate change problem via another route that people, I think, can understand and appreciate and desire.
Yeah.
I also like the idea that if you do combine those things, but in a way that fits with your culture, you can make progress without getting into a climate change fight in a politically divisive environment. And that's really worth thinking about. If your climate policy is currently stymied by a whose side are you on political divide, then you might be able to make progress just by focusing on the public health angle or sport angle or the community organization, and get the benefit to the climate via another route.
And like you say, it doesn't just have to be about lives lost. It can actually be about the financial costs of not addressing health as well. Like heat makes workers less productive, for example. So you have a less efficient workforce, and so you have the financial costs of that. And then I saw that according to the World Bank, changing climate could lead to excess health costs in low and middle income countries of at least $21 trillion by 2050.
Yeah, they're huge.
Huge
And we've
numbers.
talked about the Smart Surfaces Coalition in the States before, and that coalition, which includes architects and town planners and lawyers and consultants and aggregates providers and technology solution. It's a huge coalition. They've done really solid cost-benefit analysis of macroeconomic analysis of the benefits to a city of these strategies of greening or using the surfaces to generate power, or making the surfaces more reflective. Increasing the albedo effect sends radiation back, and that has a significant cooling effect on a city. Of course, most of our surfaces are actually dark and
concrete.
impervious. Exactly. And it doesn't help with when we have rainfall patterns that we're not used to, that produce runoff, flood our sewage systems and our subways and underground systems. And so that's a problem. Again, hard to resolve, but not impossible. There are alternatives to the kind of hard surfaces that we've got. It is quite difficult to get cities to change their procurement rules, which is one of the things you would have to do to make sure that you could substitute a more reflective surface or a more porous surface or a greener surface for those that we already have. But we are going to have to, these are adaptation techniques we are going to have to deploy.
With increasing urbanization and people living in cities more and more, even greater need.
Yeah. And then, the healthcare systems themselves can also find savings by managing their real estate in a better way. They're massive consumers of power and heat and water. So there are intelligent ways of managing the buildings that can allow us to adapt. I do think that if you can establish areas in cities that are more conducive to walking and cycling, that produces amenity. Often it improves other aspects of the living environment. There are always conflicts with road users, for example. It's not easy to make changes. You could just think of the battles over the congestion charging and various zones that cities have set up to limit the use of cars. They get fought pretty violently, actually. People don't like that change. But I think it's fair to say that if you are seriously committed to making those changes, the benefits appear relatively quickly. I would argue that the air quality in London is noticeably, it's obviously, it can be evidenced. The air quality is better. But I think people have actually experienced that. The air is cleaner. The Thames is cleaner than it was. God knows, over millennia. And I think it's worth pointing that out because a lot of our conversations are pretty doomy, but a strategy that might be in part driven by climate change to do with air pollution has produced a better environment for Londoners to live in. And most cities that have taken, if you like, the political risk of going down those routes, not all of them are perfect and not all of them work as intended. And, I don't claim that these are straightforward things to either design or implement. But when there has been a strong commitment to get that policy implemented or those policies implemented, I think it's quite straightforward. Air quality improving, life improving in those cities.
Yeah. And there are other areas as well where you see those sort of win-wins, like food, for example. There was the Planetary Health Diet that was released a few years ago, trying to find a diet that is good for both human health but also planetary health. And richer countries eat too much red meat, for example, which is bad for your health. And actually, by eating less red meat, it's also good for the environment. Ultra-processed food, not good for the environment. Lots of packaging as well. By switching to whole foods, unpackaged fruit, it's good on both sides.
Yeah. There's a long list, a long list of those things. And then, how do you make policy? How do you implement it? What opportunities are there, commercially to build enterprises around that? There are many, many, many ways to confront the pretty stark reality of what climate change means for public health systems, but also individual health, because you feel it personally if you happen to have asthma or you have some other vulnerability that climate change. It's a classic example, isn't it, of so many of the ways we talk about climate as amplifying a risk that's already there from some other reason.
Multiplier.
A multiplier, a risk multiplier. It's really what climate change does. And so, again, if you can get to grips with root causes and start implementing plans to manage and adapt those risks, you will see an improvement in whatever the other cause is. You mentioned particulate pollution in cities. Well, it's a very clear and obvious connection between that and respiratory disease.
Yeah.
And that has the evidence is, again, very clear and obvious about the effect on public health, but also on public health systems and on the cost of running them. It's a clear line of dots.
Connection, yeah.
So if you could do something to break that connection, there'll be multiple benefits.
Yeah. So it might involve working across departments in governments, for example, and lots of collaboration required, as always.
Yeah. It's a classic example of the need for government departments to cooperate, and they very often don't. But equally, as you say, an opportunity to work, to build partnerships of interest. As you know, I'm really interested in how sport might help.
Yeah.
Sporting organisations. Yeah, I guess you can look at a number of partnerships there around cycling, for example. There's been quite a lot of collaboration between political decision makers and cyclists, and even there, that's not a straightforward thing to implement and hasn't always been perfectly done, there are still many issues to iron out about how you manage cycling and cars and trucks and road use. And trying to reshape an old city is not easy. It's much easier if you're either building afresh
from scratch. Yeah.
or the layout of the city is easier to change. But old cities that have accreted villages over years and years, pretty hard to fundamentally alter their flow easily anyway. And some parts here in London, we have plenty of examples, but other cities have shown how it is possible to have cycling as an ordinary, everyday activity that takes pressure off the road system and takes pollution down. But all those political battles have to be fought and won before that happens.
I liked the example you sent me from Indonesia, I think it was, where they were experiencing a lot of issues with illegal logging because people were having to carry out illegal logging in order to pay for healthcare.
Yeah.
And so they set up local healthcare clinics where they provided a discount in the price if there was less illegal logging in that community.
Yeah.
And so by tying those things together, it was an incentive to reduce
You have to do
illegal
those things
logging.
really carefully and with deep knowledge of place.
Yeah.
So if you're designing an incentive scheme, you've got to understand very well what it is that will change behavior. And access to health when you have very minimal resources is a huge pull. It clearly dealt very directly. It took away one incentive and substituted another, and it seems to have helped. And that's a rational economic way of designing a system to change behavior. And you need to be really in tune with your own political culture to know what it is that will work. It may not work in another place, but that was an example.
Yeah,
and health, just of course, as you said before, it connects to an instinct for survival and the need to care for those who you have responsibility for. And it's strong. It's a really strong instinct. Pretty much, at the apex of what it is that motivates people to act. So if we can find a way of joining forces with that instinct, the chances are you can get quite a lot done, both to reduce emissions, but also to adapt and build resilience and feel like, as a society, we're better equipped to deal with what is coming. Mm-hmm. Well, in many cases, what has already arrived, but, we're still really absorbing it.
I guess an issue is that in wealthier countries, rich people will notice it getting hotter, but they'll buy an air conditioning unit. Will they do that? Or will they adjust their lifestyles in other ways in order to mitigate climate change?
That's a really good one, that one, isn't it?
Because air conditioning is
a really good place to look. There are loads of, there's a lot to unpack. Because we talked before about what happens when, if you can increase efficiency, for example, in the use of energy, we have this effect that we know now that people sometimes think, well, we can use more then, right?
Yeah.
And likewise, as wealth increases, India might be the classic example of rising wealth, middle class growing. What can you do with your new wealth? You could buy an air conditioner. And let's face it, it makes a massive difference. You mentioned productivity before. Well, really good evidence of the effect of extreme heat on productivity. And also increased risk. So your decision-making capabilities decline at certain temperatures. The body starts to function in a less effective way for performing tasks once you reach this. And if you get anywhere near what we know we call the wet bulb moment, where high humidity and high temperature combine, then our bodies are really, really vulnerable to just break down. Anyway, so there are all sorts of consequences that come from extreme heat and humidity. And famously, Lee Kuan Yew, the phenomenal leader of Singapore, who's really the kind of creator of the nation in many respects, when asked what was the biggest change that made the biggest difference to the economic development of Singapore, he answered air conditioning. And there's just no doubt that you can increase productivity by cooling the air in a working environment, obviously.
An indoor working environment, yeah.
But and then you figure out, okay, but that increases the use of energy massively. These cooling machines are really not all that efficient. They're quite hard to control. We can't really control them externally. Actually, you can now. We'll come to that. And they effectively cool the inside and expel warmer air into the public realm. It almost emphasizing that division between those who have and those who have not, because the street receives the warmer air, the expelled air. So, but that's before you get to the fact that they have chemicals that do the cooling. That we've phased out a lot of the ozone depleting substances, but they have a global warming potential which is high, and they leak. Right? They leak, and they're quite expensive to maintain. So there are all kinds of problems associated with air conditioning, along with clearly a benefit from their use. So figuring out, well, what can we do about that? Well, actually, some of the things we talked about before, you can reduce air conditioning demand if you have a very efficient building, so a well-designed, well-insulated building. Equally, if you've got a green roof, or you've got trees round about shading the building, you will reduce air conditioning demand. If the building is designed in a way that allows air to flow freely in it, if you've got individual controls over rooms as opposed to the whole space, you can control demand. If you can control externally, which increasingly you can.
What do you mean by control externally?
So I've mentioned before a company I've been involved with from the beginning called Verve.energy. Well, they have a technology that allows you to monitor use remotely, so that you basically so many of these ways of using, basically digitizing the information that you send to a control system that allows you to understand what is happening to it, to monitor the power usage, but also, in this case, the leakage of SF6 would be one of the chemicals. So our capacity to collect and analyze and distribute the data that tells you about performance has massively increased. And so that gives you some opportunity to manage the usage better. But for a whole city, you really want to go down the smart surfaces approach rather than depend upon air conditioning.
I was in Spain recently, and they have in Barcelona a climate shelters network. So we were staying somewhere with no air conditioning, and after a few hours, just boiling, went to the shopping mall, which is has a sign outside saying climate shelter, and you go there and there's obviously air conditioning, and you can just sit there for a drink. And yeah, it's strange.
Did you see the
there's
misting
a map
ones?
Online with.
There are some places where they
No, I didn't see those.
They spray a cool mist for the same purpose. I mean, that is something to pay attention to, isn't it?
Yeah.
That, a European city where that is necessary.
There's an online map, with libraries, shopping centres.
I mean, it's a sign of adaptation.
Yeah.
It's a manifestation of the point we are making, that health is really driving that intervention, but it's climate change that's creating the need for it. And there's probably quite a few European cities now who have something like that allow people who just out and about during the day. But, we talked about this before, that it's quite something. We've come to the point where in a European city, there's real risk in just going out during the day. And then when it comes to getting work done, obviously extreme heat affects your ability to just get stuff done outdoors.
Yeah, particularly if you're an outdoor
Right.
construction worker.
Construction worker or agricultural worker. And so the prospect of switching that kind of work tonight, that does feel like a bleak future. So anyway, my sense is that this is a good pathway to action, and because there are these win-win. I know as soon as you mention it, you think, I wish I hadn't said that, but there are these genuine solutions to more than one problem that can be pursued. That seems like a good thing for most societies to zoom in on, and allows you to have a sensible conversation about getting stuff done.
Migration is something we haven't spoken about as well.
No, but it's a factor.
Yeah, and the overcrowding, poor sanitation, lack of access to healthcare that comes with migrating communities. That's another area.
Yeah, and Lord knows that produces a stress on our political systems. It's just really hard to manage. Doesn't really matter what colour your rosette is or where you are in the world. That it's like so much of this problem. It's not the change itself, it's the rate of change. It's not even just the numbers of migration, although, of course, that is a factor. Sheer numbers makes a difference to your capacity to cope. But the speed, the amount of people that are coming in a relatively short period of time, really difficult to assimilate. Really difficult. Again, honestly, it's something I know I harp on about, but so desperately trying to avoid splitting our communities up into for and against just because of how they voted last time or how they might vote next time. It makes it so much harder to deal with complicated problems like this one. I don't think it makes a blind bit of difference who the governing party is in any part of the world. Coping with the movement of people is hard. And everybody is grappling with how best to deal with the movement of people. And the movement of people is actually the simplest way of explaining what's going on. The different ways we define them: migrants, refugees, asylum seekers. The much bigger issue is the movement of people who will always move if they are feeling high risk, insecurity, fleeing conflict, or because of the climate change has devastated their crops or whatever it is.
The health impacts of climate change are such
They'll always move, and they'll move to somewhere better. And they'll make that judgment there and then, and they'll find the roots. And after that, everybody everywhere is just going to have to figure out how to live peaceably when that happens. And it is going to happen more because of climate change. It's just.
Yeah, look at Pakistan this week and the floods and the hundreds and hundreds of people that
huge
have been
numbers.
killed.
Right. And then if you've got, we were talking earlier about retreating glaciers. There are various parts of the world where the consequences for the water system are really extreme. And if you have retreating glaciers and you have lack of access to the kind of steady flow from the release of mountain ice to water, to rivers, to irrigation, when whole areas become vulnerable in that way, of course, those populations will move. And they'll keep searching for wherever it is that it is a safe and hopefully a place where they can prosper as individuals or families or communities. So we've just got to grapple with that and figure out how we're going to cope and manage with it. But one way to cope better is to deal very directly with the cause.
Yeah.
All right? So yes, we're going to have to adapt. We're going to have to be more resilient. Well, our public healthcare systems are going to have to cope. We saw that interesting partnership between the Met Office here and our NHS, because we know that when we have extreme events, heat waves or floods, it puts immense pressure on the public healthcare system, which is already under immense pressure. So the Met Office is working with the NHS to model and to predict and to help the preparedness of the system for these events. That's an example of institutions collaborating in a sensible way. I would say that most public healthcare systems, if they're not already doing it, should be working together with their Met Office or the other ways in which they have their scientific institutions, provided they're properly funded, can help with the way the communities can adapt. But that's our future. So we've got to deal well with it. And if we can at the same time promote, other values that we care about in our personal and familial and public health, then so much the better.
Yeah. Yeah, like you say, it's a risk multiplier. It's not that people have being too hot on their death certificate. It's the fact that if you have conditions, it exacerbates and makes it more likely that you will suffer and die from those conditions.
Yeah, and we're talking about climate rather than weather. It's not. One always wants to look for is there anything positive we can say about this? So, unfortunately, it's not about more vitamin D. It's a different set of concerns, and it's largely to do with a phenomenon that affects many other risks that our society runs routinely every day and has to manage. And because climate change amplifies these risks, they have to be dealt with in a slightly different way. But the good news, if one wants to focus on that, is that if you go right at the root causes in energy, transport, land management, food production, if you go right at those causes and you do it in a way that does join up our healthcare systems and the way in which we manage public health, but also the way in which individuals and communities can look after their own health, there's a whole long set of good responses, sensible responses, manageable responses that actually ultimately reduce cost, but they require focus and attention and discipline and being aware of the trade-offs and communicating them clearly to a public that will be concerned and is interested in health.
Yeah, drive climate action through considering the health impacts.
Seems sensible.
So there's no doubt that climate change will impact our health, but all is not lost. There is things we can do.
It does appear that if you can get focus on health to drive action on climate, there's plenty to do, and it feels positive.
Thank you so much for listening to Fossil vs. Future. If you enjoyed this episode, please subscribe and give us a rating. Follow us on social media and send us your what about questions that you'd like us to discuss.